Did you know a common medical dye, the same bright blue liquid used in hospitals, could turn deadly when mixed with everyday medications? It's called methylene blue, and while it's used safely in medicine, certain combinations can trigger life-threatening reactions that even some doctors overlook. Today, we'll expose the shocking drug interactions that could put millions of older adults at risk and show you how to stay safe. Before we dive deep into this medical mystery, I need to be crystal clear about something. This video is purely educational and for entertainment purposes and should never replace professional medical advice. If you're taking any medications, always consult your healthcare provider before making changes or if you have concerns about drug interactions. So what exactly is methylene blue? Most people have never heard of it, yet it's been hiding in plain sight in hospitals and clinics worldwide for over a century. This synthetic compound, with its distinctive deep blue color, serves multiple purposes in modern medicine. Doctors use it to treat a rare condition called methemoglobinemia, where your blood can't carry oxygen properly. It's also used as a diagnostic tool during certain surgeries, helping surgeons identify specific tissues and structures. Some alternative health practitioners even promote it for cognitive enhancement, though that's a whole different conversation with its own set of risks. Here's where things get dangerous. Methylene blue doesn't just sit quietly in your system. It actively interferes with specific enzymes and neurotransmitter pathways, and when it encounters certain medications, the results can be catastrophic. The most notorious and potentially deadly interaction occurs with a class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs. Like and subscribe to the channel so we can benefit you by creating more great content with you in mind. And as a thank you, download this video's free guide from the link in the description below. SSRIs are among the most commonly prescribed medications in the world. We're talking about household names like Prozac, Zoloft, Paxil, and Lexapro. These drugs work by increasing serotonin levels in your brain, helping to alleviate depression and anxiety. But here's the terrifying part. When methylene blue meets these medications, it can trigger something called serotonin syndrome. Serotonin syndrome isn't just a minor side effect you can brush off. This is a genuine medical emergency that can develop within hours and potentially kill you. The symptoms start subtly, maybe some confusion, agitation, or restlessness. But then things escalate rapidly. Your heart rate skyrockets, your blood pressure becomes dangerously unstable, and your body temperature can spike to life-threatening levels. Severe muscle rigidity sets in, and in the worst cases, patients experience seizures, coma, or death. But SSRIs aren't the only culprits in this dangerous dance. Methylene blue also has serious interactions with another class of antidepressants called monoamine oxidase inhibitors, or MAOIs. These include medications like Nardil and Parnate. The combination can create the same deadly serotonin syndrome, but MAOIs present an additional layer of complexity because they're already known for having extensive food and drug interactions. The interaction mechanism is fascinating yet terrifying. Methylene blue acts as what scientists call a monoamine oxidase inhibitor, similar to those MAOI antidepressants I just mentioned. When you combine it with medications that increase serotonin, you're essentially creating a perfect storm in your neurotransmitter system. It's like having two drivers fighting for control of the same car while speeding down a highway. Here's something that might shock you. The dangerous interactions aren't limited to obvious psychiatric medications. Some pain medications can also create problems when combined with methylene blue. Certain opioids, particularly those that affect serotonin levels like tramadol and meperidine, can contribute to serotonin syndrome when methylene blue enters the picture. Even more surprising is that some over-the-counter medications and supplements can be problematic. St. John's wort, a popular herbal supplement that many people use for mild depression, can interact dangerously with methylene blue. Dextromethorphan, found in many cough syrups, is another unexpected culprit that can contribute to serotonin toxicity. The timing of these interactions is crucial and adds another layer of complexity to the problem. You don't need to take methylene blue and these other medications simultaneously for dangerous interactions to occur. Methylene blue can remain active in your system for hours, and some of the problematic medications can linger even longer. This means that interactions can happen even if there's a gap between when you take different substances. What makes this situation particularly dangerous is that many people don't even realize they're being exposed to methylene blue. It's not like you're taking a pill labeled methylene blue at home. Instead, you might receive it during a medical procedure, and if you don't specifically inform your medical team about all your medications, including over-the-counter drugs and supplements, they might not realize the potential for interaction. The medical community has recognized these risks, and there are specific protocols that should be followed. If you're taking SSRIs or MAOIs, medical professionals are supposed to stop these medications well in advance of any procedure involving methylene blue. For SSRIs, the general recommendation is to discontinue them at least 2 weeks before methylene blue administration. For MAOIs, the waiting period is even longer, sometimes up to a month, because these medications have longer-lasting effects on your enzyme systems. But here's a real-world problem. Not all healthcare providers are equally aware of these interactions. Methylene blue is often administered by specialists who might not have complete information about your medication history, or they might not immediately think to ask about psychiatric medications when performing a routine procedure. This communication gap can create dangerous situations. The dose of methylene blue matters significantly in determining interaction risk. Lower doses, typically less than 2 milligrams per kilogram of body weight, are generally considered safer, though interactions can still occur. Higher doses dramatically increase the risk of serotonin syndrome, especially when combined with serotonin-affecting medications. Interestingly, the route of administration also affects interaction risk. Intravenous methylene blue tends to create more pronounced interactions compared to oral administration, partly because it reaches higher blood concentrations more quickly. However, this doesn't mean oral methylene blue is safe. It's just potentially less immediately dangerous. Beyond the well-known serotonin-related interactions, methylene blue can interfere with other medications in surprising ways. It can affect how certain heart medications work, potentially altering their effectiveness or increasing side effect risks. Some blood pressure medications may also behave differently in the presence of methylene blue, though these interactions are generally less immediately life-threatening than serotonin syndrome. The interaction with heart medications is particularly concerning for older adults who are more likely to be taking multiple medications for various conditions. Age-related changes in how the body processes drugs can make these interactions more unpredictable and potentially more severe. For people considering methylene blue for off-label uses, like cognitive enhancement, these interaction risks become even more important to consider. Unlike medical procedures where methylene blue use is carefully controlled and monitored, self-administration creates scenarios where people might not fully understand or prepare for potential interactions. The symptoms of serotonin syndrome can be subtle at first, which makes early recognition challenging. Mental status changes might be attributed to anxiety about a medical procedure or stress. Mild increases in heart rate might be dismissed as normal nervousness. This is why it's crucial for both patients and healthcare providers to maintain high awareness of interaction possibilities. If you suspect serotonin syndrome is developing, seek immediate medical attention. Emergency treatment typically involves stopping all serotonin-affecting medications, providing supportive care to manage symptoms, and sometimes administering specific medications to counteract the serotonin excess. Time is critical. The faster treatment begins, the better the outcome is likely to be. Prevention remains the best strategy for managing these dangerous interactions. This means being incredibly thorough when discussing your medication history with healthcare providers. Don't just mention prescription medications. Include over-the-counter drugs, herbal supplements, and even recreational substances that might affect serotonin levels. Keep a comprehensive list of all substances you take, including doses and timing. Consider using a medication management app or carrying a written list with you to medical appointments. When scheduling procedures that might involve methylene blue, specifically ask about medication interactions and whether you need to temporarily stop any of your current medications. The responsibility isn't entirely on patients, though. Healthcare systems need better protocols for identifying and managing these interactions. Electronic health records should flag potential methylene blue interactions automatically, and medical teams should have standardized checklists to review before administering it. As our understanding of these interactions continues to evolve, it's likely that we'll discover additional medications that can create problems when combined with methylene blue. The key is maintaining awareness and taking a cautious approach when multiple medications are involved. Remember, the goal isn't to fear methylene blue or avoid necessary medical procedures. When used appropriately with proper precautions, methylene blue can be an important and relatively safe medical tool. The danger lies in the unexpected interactions that occur when proper screening and preparation don't happen. If you found this information valuable, consider sharing it with friends and family members who might benefit from understanding these risks. Knowledge about medication interactions can literally save lives, and the more people who understand these dangers, the safer we all become. Stay informed, stay cautious, and always prioritize open communication with your healthcare providers about everything you're taking.